If your joints ache, swell, or feel stiff, it could be arthritis. But here's the surprising part. Not all arthritis is the same. In fact, rheumatoid arthritis and osteoarthritis are two completely different diseases, and confusing them can lead to the wrong treatment. Arthritis is often thought of as just wear and tear, but that's only part of the story. Rheumatoid arthritis, RA, and osteoarthritis, OA, affect millions of people worldwide, yet they work in completely different ways. In this video, we're breaking down the key differences between rheumatoid arthritis and osteoarthritis. What causes them, how symptoms differ, who's most at risk, and how treatments are tailored. By the end, you'll have a clear understanding of these conditions in plain, everyday language. What is osteoarthritis? Osteoarthritis is the most common form of arthritis. It's often called the Rheumatoid arthritis because it happens when the cartilage, the cushion that protects the ends of your bones, breaks down over time. When that cartilage wears away, bones rub against each other. This leads to pain, stiffness, and swelling in the joints. Key points about OA. Usually develops gradually, often after age 50. Common in weight-bearing joints like knees, hips, and spine, but can also affect hands. Risk factors include aging, obesity, joint injuries, and genetics. Think of it like this. Osteoarthritis is a mechanical problem. The joint is wearing down, just like the tread on a tire. What is rheumatoid arthritis? Rheumatoid arthritis is very different. RA is an autoimmune disease, which means the immune system mistakenly attacks the body's own tissues. In this case, it attacks the lining of the joints, called the synovium. This immune attack causes inflammation, pain, swelling, and over time, can damage cartilage and bone. Unlike OA, RA isn't just about aging or wear, it's about the immune system going haywire. Key points about RA can develop at any age, but often between ages 30 and 60. More common in women. Symptoms are often symmetrical. If one wrist is affected, the other usually is too. Can also affect organs like the lungs, heart, or eyes. Think of RA as an inflammatory problem. The body's defenses mistakenly attacking the joints. How do you tell them apart? Let's compare. Pain pattern. OA pain worsens with activity and improves with rest. RA pain can feel worse in the morning, with stiffness lasting over an hour, and may improve with movement. Joints affected. OA often affects knees, hips, spine, and sometimes fingers, especially end joints. RA often targets smaller joints first, hands, wrists, feet, and usually on both sides of the body. Other symptoms. OA is usually limited to the joints themselves. RA may cause fatigue, fever, weight loss, and overall feeling unwell, because it's a systemic disease. Here's the challenge. Because both conditions cause joint pain and stiffness, people often mistake one for the other. Even doctors need blood tests, x-rays, or scans to confirm the diagnosis. The problem is that treatments are completely different. Treating RA like OA, or vice versa, can delay the right care and make the condition worse. How doctors diagnose osteoarthritis. Usually diagnosed with x-rays showing joint space narrowing, bone spurs, or cartilage loss. Rheumatoid arthritis. Blood tests can detect markers like rheumatoid factor, RF, or anti-CCP antibodies. And scans may show inflammation or early bone erosion. Treatments for osteoarthritis. Since OA is mechanical, treatments focus on lifestyle, weight management, exercise, physical therapy, medications, pain relievers like acetaminophen, NSAIDs, or joint injections, surgery, joint replacement in severe cases. Treatments for rheumatoid arthritis. Since RA is autoimmune, treatments focus on controlling the immune system, DMARDs, disease-modifying anti-rheumatic drugs, like methotrexate, biologics, advanced drugs that target specific parts of the immune system. Lifestyle, exercise, and anti-inflammatory diets can help. The goal with RA isn't just to relieve pain, but to stop the immune system from damaging the joints long-term. For someone with OA, pain might stop them from walking long distances or climbing stairs, but rest usually helps. For someone with RA, even simple daily tasks like buttoning a shirt or holding a cup can feel impossible, and fatigue can be overwhelming. Both conditions can limit independence and quality of life, but knowing which one you're dealing with changes everything about how it's treated. Here's the key takeaway. Osteoarthritis and rheumatoid arthritis are not the same thing. OA is wear and tear of the joints. RA is an autoimmune attack on the joints. OA is mechanical, RA is inflammatory. OA treatment focuses on pain management and mobility. RA treatment focuses on calming the immune system. Understanding this difference can mean faster diagnosis, the right treatment, and a better quality of life. So, let's recap the differences between RA and OA. OA, wear and tear, gradual, often after age 50, worsens with activity, usually limited to joints. RA, autoimmune, any age, but often 30 to 60. Symmetrical, worse in the morning, systemic with fatigue and organ involvement. Treatments. OA equals lifestyle plus pain relief. RA equals immune system control. If you or someone you love is struggling with joint pain, don't assume it's just aging. Talk to a doctor and get the right diagnosis, because the difference between RA and OA is the difference between managing pain and stopping disease progression.